Tetanus means being taught, which is a good description of the disease caused by bacteria called Clostridium tetani. Clostridia, as a family, are obligate anaerobes, meaning that oxygen is toxic to them. In nature, they thrive in deep, compact soil, and when they feel the stress of fresh oxygenated air, they often produce spores, which are metabolically inert and extremely resilient to the environment. Then, when environmental conditions improve, the spores are able to sprout into fully fledged Clostridia. When doing a gram stain, Clostridium tetani stains purple, or gram-positive, and it's a bacillus, meaning that it looks like a big cylinder or rod under the microscope. Clostridium tetani is notorious for one of its toxins, called tetanospasmin, which can severely disrupt the neuromuscular system of mammals. Tetanospasmin works by entering special inhibitory neurons called Renshaw cells. Once they get inside, tetanospasmin cleaves snare proteins, which are proteins that pull vesicles that are loaded with neurotransmitters to the neuron membrane. When the snare proteins are cleaved, it prevents the release of inhibitory neurotransmitters, like glycine and GABA. You can think of snare proteins as the rails, and the vesicles as trains that are loaded with neurotransmitters. The tetanospasmin destroys the rails so that the trains can't move. The role of Renshaw cells and inhibitory neurotransmitters is to fine-tune the action of the alpha motor neuron, which is in charge of sending the actual signal for contraction to the muscle. In tetanus, Renshaw cells fail to work, and the alpha motor neuron keeps firing without any inhibitory control, causing muscle rigidity and spasm. The classical tetanic triad of symptoms involves trismus, or lockjaw, which are mild to severe spasms of the lower jaw, rhesus sardinicus, or Sardinian grin, which is an abnormal-looking, sustained grin caused by facial muscle spasm, and opisthotonus, which is a severe spasm of all muscles in the body simultaneously, resulting in a high arched back and patient resting on his heels and the back of his head. Tetanus only affects skeletal muscle, so smooth muscle and cardiac muscle continue to function normally. Other symptoms of tetanus involve sympathetic overactivity, which causes drooling, excessive sweating, fever, difficulty swallowing, breathing problems, and irregular urination and defecation. Tetanus is usually treated with tetanus immune globulin, or TIG, which is an antitoxin that binds to circulating tetanospasmin. In addition, muscle relaxants, pain medication, and other supportive care measures are taken, while the immune system clears the infection. Full recovery can take a few months of intensive care, as the body's neurons slowly heal. Fortunately, tetanus infection can be prevented with the tetanus toxoid vaccine. Vaccination generates active immunity by injecting weakened or dead versions of the disease agent into the body. Tetanus vaccines in childhood and adolescence are given in the form of a triple vaccine that covers diphtheria, tetanus, and pertussis in a single jab.